Cardiogenic shock is a complete medical emergency. The whole body is in shock. All the vital organs of the body are not getting enough blood. Now, this flowchart completely describes it. There is decreased stroke volume. This subsequently leads to decreased cardiac output, subsequently leading to decreased tissue perfusion. Now, when we have tissue perfusion, we definitely have cell injury. So this is the pathophysiology, and the most important thing for you to capture in this is that there is just decreased cardiac output, and this in turn leads to decreased tissue perfusion. Anything that affects the heart's ability to pump out adequate blood to the body is going to be a cause to cardiogenic shock. The most common is heart attack, that is myocardial infarction, followed closely by heart failure. Then we're going to talk about inflammation to the muscle part of the heart, that is myocarditis, and any infection in the heart, especially endocarditis is going to cause this. Any drug overdose, basically just anything that affects the heart's ability to pump out blood is definitely going to be a cause. How are you going to diagnose this? The first thing is hypotension. It's very key. The BPs are going to be extremely low. However much fluids you give, these BPs are not going up. Okay. The next thing, on the ECG, you're going to see tachycardia. When we do a chest X-ray, it's going to reveal that there's some fluid in your lungs. And when we do an echocardiogram, it is going to show us any damages to your heart. When we go to do cardiac catheterization, it is going to reveal presence of a narrowed artery. This is mostly done through a dye. Now, on the clinical manifestations, we are likely to have crackles, and this is a result of blood backflow from the left side of the heart to the lungs. Subsequently, this is going to lead to dyspnea, so that's another clinical manifestation. As the shock progresses, we are likely to have blood backing from the right side of the heart to the lungs. This subsequently will lead to distended neck veins, you see, and increased central venous pressure. We have already talked about chest pains, it was dyspnea, difficulty in breathing, and then we're having chest pains, and of course, we've already addressed the low BPs. On the brain, we'll have confusion, agitation, and restlessness, and then down to the kidneys. This is key. This is a key manifestation of cardiogenic shock. The first one is definitely oliguria. This is low urine output, water retention, and renal failure. When you talk about the skin, it is going to be cold and clammy, very low capillary refill. Definitely because of the hypertension, what is going to happen? It is going to be pale as well, okay? So I think we can actually gather all these signs together. There is reduced cardiac output, so there is low BPs. If the BPs are low, the heart is beating fast to try to compensate for the low cardiac output or the low stroke volume. So there's definitely going to be tachycardia. So definitely weak peripheral pulses, cold and clammy skin, confusion, restlessness is happening at the same time. You're having crackles. All these things are related to one another. It is so hard to miss any question or any patient that is having cardiogenic shock if you have this in mind. Okay, so now let's go to the nursing interventions. We want to monitor the BPs of this patient, the vital signs, all of them. Okay, that's the first thing we want to be doing. Of course, ABC circulation is already affected. It's in our priority. And of course, even breathing, we have tachycardia there. So these are the first things we're going to be doing. We are doing hemodynamic monitoring. And we are maintaining mechanical ventilation. We are having a CVC for medication. We're in constant monitoring of the mental status of this patient. We are assessing the input and output because of the oliguria. You see, everything that we are doing is actually cutting across the signs and symptoms. Now, on the medication, we are choosing a drug that is going to increase the heart's ability to pump out enough blood. At the same time, it is medications that are reducing, any chances of clot formation or dissolving the already formed clots if there are any. Okay. For example, we're going to be using vasopressors, e.g. epinephrine and norepinephrine. Epinephrine and norepinephrine in this case will increase the myocardium contractility. And then, of course, we are using inotropic agents, for example, dopamine. This increases the pumping function of the heart. Another medication you're likely to use is aspirin. This is going to reduce the chances of clots forming and keeps blood moving through a narrowed vessel. And then antiplatelet medication like clopidogrel might also be considered, okay? Now, in the case that all these medications do not work, then we are going to do surgeries, and these include angioplasty and stenting, coronary artery bypass, and then VAD, that is ventricular assist device. These are the most common surgeries that are going to be used to correct this problem of the heart. And if all these fail, we are going to need a heart transplant, okay? I hope you've learned something today. I'm going to go through a quiz, just I think 2 or 3 questions to see how well we did. And even as you go to that quiz, remember there's a medical emergency. This patient is likely to go into a coma. So everything we do is fast-paced. Let's go and dive into the first question. A patient is being treated for cardiogenic shock. Which statement below describes this condition? Select that apply. A, the patient will experience an increase in cardiac output due to an increase in preload and afterload. A patient with this condition will experience decreased cardiac output and decreased tissue perfusion. C, the condition occurs before the heart, because the heart has an inadequate blood volume to pump. And G, cardiogenic shock leads to pulmonary edema. I think the only right answers here, without even looking so much, is B and G, because we said it decreases cardiac output and decreases tissue perfusion, right? And then we said it leads to pulmonary edema, and that is where we have crackers, okay? Which medications below are used in cardiogenic shock that provide a positive inotropic effect on the heart? Select all that apply. Nitroglycerin, sodium dihydroperoxide, dobutamine, norepinephrine, and dopamine. You're assessing your patient with cardiogenic shock. What signs and symptoms do you expect to find in this condition? Select that apply. A, warm flushed skin. That is not okay. That is wrong, because it's supposed to be cold and clammy. Prolonged capillary refill. That is okay. Urinary output over 30 mL per hour. That is wrong. We're supposed to be having oliguria. Systolic blood pressure less over 90. That is right. Crackles. That is right. Dyspnea is right. G, decreased BUN and creatinine. That is wrong. We're expecting strong peripheral pulses and chest pain. Those are right answers.